We've got two wonderful ladies here that are going to present tonight's seminar for us. Joyce Rubenfield is the first one. She's a registered oncology nurse at this St. Vincent Cancer Center in Santa Fe in the treatment center, which is up on the second floor there. And one of the tasks that she has, one of her jobs, or one of the things that she does, is to counsel people who are starting various different treatment regimes as to what they can expect through the treatment, what they can expect in terms of the side effects of the treatment, and what they can do practically to ameliorate all of those side effects. And I know I've been to see her twice already, and she does a really good job at that. The second time I saw her, I looked around her office when she went back to do some paperwork, and I saw some literature from the American Cancer Society. There was a cookbook there, and there were 2 pamphlets on caregiving. I thought, wow, that's interesting. So when she came back, I mentioned to her, you know, it might be a good idea to do a seminar on this. She said, well, take one. I said, one of each? She said, yes. Okay, so I did. It was a big hit with our board. And she said, what you might do is go to the people in our social services department and check with them. And I thought, okay, I didn't know anything about that, but it took me a while to track down the head of the Cancer Foundation for New Mexico, who sent me to Ronnie Levine, who also does support groups for caregivers at the Cancer Foundation for New Mexico, CFNM. So I contacted her. We had a nice long chat one day. She said she was very interested in giving a talk to us, and she said she'd get together with Joyce. I said, Joyce? You mean the Joyce from upstairs? She said, yes. You know her? Yes. Well, you know, Joyce not only has a degree in nursing, but she has a master's degree in counseling. And so Ronnie said, well, when she was getting a master's degree, I mentored her. And we both learned a lot from that. Joyce, Ronnie, by the way, is a certified marriage and family counselor herself, both in the state of California and New Mexico. So as things turned around, it came around full circle, and we now have 2 very wonderful people, and the synergy between them should be great for giving this talk tonight. So I think Joyce was going to come up first, or whoever is, here she is. Yes. This is Joyce Rubenfield.
I think I have my own, Tom, but thank you very much. So I tried to move closer to all of you, and now you're all spread out there. When I meet with patients in Santa Fe, we'd be outside if you were that far away. It's a very small room. So I'm going to start by, hi Jerry. I'm going to start by telling you a little bit more about what I do. And then I'll just go into a few things that I've gleaned from all the caregivers. Because I have to say, I stopped to think about why do they want me to come and talk to them? What do I know? But what I know comes from my 45 years of nursing and learning from patients and families. And a few of my own experiences as a caregiver as well. So when patients are diagnosed in Santa Fe, as soon as the physician has a treatment plan, then the patients and hopefully their family come to an education appointment to find out more about the treatment. Now, I don't go into details about their pathology or why the doctor chose their treatment. I'm just focusing on side effects and how they're going to affect someone's life, and try to give both the patient and family members tips about how to stay healthy and get through this period of time. And actually, I'm just remembering there was something I wanted to read that may be familiar to some of you. It's a poem that I think really addresses the patient and definitely the caregiver's life. It's called The Guest House. Anybody familiar with this? This being human is a guest house. Every morning, a new arrival. A joy, a depression, a meanness. Some momentary awareness comes as an unexpected visitor. Welcome and entertain them all. Even if they're a crowd of sorrows who violently sweep your house empty of its furniture, still treat each guest honorably. They may be clearing you out for some new delight. The dark thought, the shame, the malice, meet them at the door laughing and invite them in. Be grateful for whoever comes, because each has been sent as a guide from beyond. And that's Rumi. So one thing that I think is really important for people going through cancer treatment is to maintain as much normalcy in their life as possible. There are going to be days of sickness, but there are also going to be a lot of days where you can just appreciate your life and carry on, believe it or not, as usual. And you really need to focus on that. You need to focus on nutrition, staying as healthy as possible in general. Keeping up with physical activity is good for general health and emotional well-being, can help people sleep at night. And these are directions usually for the patient, but guess what? It's also for the caregiver, right? So that's one thing I really want to point out to families that come to these meetings with the patient is the patient has the physical illness, but you have the emotional stress. I have so often seen a patient just say, here, you take this. And I don't mean out loud verbally, but I can see that they have done that. They have, I don't want to say shut down, but they are so focused on what's happening to them physically that they really shut out everything else. And so this can lead to role changes if it's the older traditional family of the man being the one who's the primary breadwinner, accountant, taking care of the cars, whatever, and he becomes the patient and can't do these things, then the woman has to step into these roles. And one of the books that I was reviewing in preparation for this, the author was relaying a particular story where the wife was extremely shy and meek, and she rarely even left her house. You know, she was happy to just be at home alone all the time, and everyone thought, what's going to happen to them when he can't do these things? And lo and behold, she stepped up and became a completely different person, and she was able to take on everything. Now, does that always happen? No. Sometimes, I think something else that we have to keep in mind, particularly on the medical side, is what's a family and what is family support? That might be husband and wife, that might be adult children, or in terms of a young adult, it might be older parents stepping in to help. But this could be a single person. They may have a family that they create from friends and community members that step in. And that's what their caregiving looks like. The thing that scares me the most as a nurse is a patient who comes in by themselves. And I'm going to be giving them all this material. I don't know if you've ever seen the cartoons about what does a dog hear when we talk to them? And it's blah, 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 food, or dinner time, or cookie, and that's all they hear. Well, when a patient comes in and gets the diagnosis of cancer, they don't hear anything else. And so to come to the education appointment, I really try to offer a lot more information than just that medical piece. And also my appointments are an hour long. Some patients need 15 minutes and we're done. Other people need that full hour. And sometimes it's focused on the medical things, and sometimes it's focused on emotional needs or how to put together your family, okay? I started to say what scares me the most is when somebody comes in by themselves. So how are they going to retain all that information? We have a packet that we hand out that has common side effects in it so that people can refer to that. There's 2 phone numbers in there where people have 24-hour access to us to be able to ask questions, or if they have urgent needs at night or the weekend when we're closed. So I wanted to talk just about nursing a little bit. Are there any nurses here? 1, 2. Okay, all right. When I became a nurse, so it was a long time ago, there was a textbook that we had called The Art, Science, and Spirit of Nursing. And I really believed that that's what it was. But over the years, I think we've become little doctors. You're meant to know almost as much as they know. You're meant to be their backup if there's a miscalculation or something. You're just as responsible for it as they are. And then the pharmacy also has to do all those checks. In recent years, I've been happy to find that there is now a new branch of nursing that people can specialize in called holistic nursing. And guess what? It's back to the art and the spirit of nursing. It's not focused on science so much anymore. Because I think we've learned that it's a heart connection that really, really makes a difference. Okay, let me just see if I can set up my notes here without knocking everything down. So some of the training I've done besides nursing, Tom mentioned the Masters in Counseling, and I just felt that that would be beneficial for that particular role. But I've also taken a couple of courses on being with dying. Upaya gives a great 10-day course on being with dying, and there was another program called the Meta Institute in California, which is where these things come from. Frank Ostaseski ran that. And the reason why I bring dying into this caregiving talk is that back to that bubble of what does the dog hear when you're talking to them, and now what does the patient hear? When we say cancer, if we really just thought cancer, we might just go to treatment. But I think what really happens is that when we hear cancer, it's such a scary diagnosis that we very quickly also go to dying, okay? We might not be real conscious of that, but that's the fear of is this treatment going to work? Once the treatment's over, The patient and the family also then have to live constantly with, is it going to come back? When is my next scan? Waiting for my results. This fear is always there. And so in my mind, the more attention we can pay to being more comfortable with death also leads us to a greater comfort with life, and it also facilitates and eases the job of the caregiver. It just facilitates conversation, okay? Because if a patient is not in a situation of being cured of their cancer, then it really behooves them to examine their life. And I'm jumping ahead. That'll be the next guy. So Frank Ostaseski is primarily a Buddhist teacher, and he started the Zen Hospice Center in San Francisco some 20-some years ago. So he has these 5 precepts that he's come up with. And to me, these, again, aren't just about dying. These are really about engaging. Welcome everything, push away nothing. So finding and establishing a comfort level and being able to be with whatever a patient needs, okay? And that's whether, you know, like me, a staff member, a nurse, it's the family as well. And try to almost leave yourself at the door, you know? You're there in service. And yes, your role, which Ronnie will address more directly about taking care of yourself, really is a separate job. Bring your whole self to the experience. So really engage from the mind, intellectually, engage from the heart in terms of feelings, and also engage just physically in the body to be able to be aware of what you're experiencing. Don't wait. So sometimes we really focus on waiting for the perfect time to address something, or an experience at, you know, the appointment with the doctor. We're going to wait for that. But if we are able to stay present, we might find that the perfect time for it just arrives naturally. Find a place of rest in the middle of things. So I said, leave yourself at the door when you're serving somebody else, but you do need to still have that awareness of yourself, and you need to find something that can help relax you when you do start to pick up attention in yourself. And that might simply be a moment where you look down and maybe drop your gaze and just take a slow, deep breath and really feel your breath. Feel your feet on the ground and just ground yourself to be able to continue with whatever you're trying to engage with the patient. Cultivate don't know mind. I personally have found this to be really helpful if I'm with a patient and family that are really charged up, and I start to feel like I want to push back, and that's not going to help anything. So with the don't know mind, if I just start to ask more questions, you know, where's this anger coming from? Well, probably the cancer diagnosis, but just ask questions and try to elicit more information. That can not only help you, but it might also help the person that you're giving care to focus on their thoughts, okay? So this other list, I took from Dr. Jeremy Geffen's book, which I have to tell you, if you have somebody with a cancer diagnosis, this is an old book, 2007, I think, The Journey Through Cancer by Dr. Jeremy Geffen. And I meant to look up before I came, and I apologize, I forgot. I know Dr. Geffen was diagnosed with prostate cancer some years ago. I don't know if he's still practicing or not. But he's written this book focused around 7 steps that he likes to take with his patient. Okay, the first one is simply providing education, and the patient and caregivers should make sure that they have the education they need, the information they need from the physician, possibly a second opinion, another physician, possibly education they do on their own, reading, meeting nurse like me, getting more information, being sure they have all the details to be able to move forward and make the proper decisions, okay? And to take time for that before rushing in. Connection with others. This is the whole purpose of the caregiver support groups, okay? Or patient support groups. I tell patients nowadays, you know, it's so different from when my parents were alive. They would go in, I always think of my mom, she would dress up to go to the doctor and just sit there with her hands on her purse and just listen to the doctor and not volunteer any information. Nowadays, we have a lot of patients who come in very well educated. They're probably all from Los Alamos, I'm sure. But having a connection with somebody else that's in the same boat is I don't think there's anything better from what I understand from patients or a caregiver going to caregiver support group. The body is garden. So then Dr. Geffen speaks about what I was saying about keeping general health up, paying attention to nutrition, hydration, exercise, emotional healing, not stuffing those feelings that come along with the diagnosis, not stuffing the feelings that come with having your family mixed up and roles being changed. The nature of mind. So what that addresses is the stories that we tell ourselves. Maybe we come into cancer treatment saying, I'm not taking those drugs. I'm opposed to those drugs. So, you know, just exploring where you ever had that opinion from, okay? Life assessment. So this is it can be for anybody, but it's very important, again, for patients who are not in a curative situation. There can be great value with looking back on your life, looking at your relationship, because how can we know where we're going if we don't examine where we've been? Have we done the things that were important to us? Have we met the goals that we had laid out for ourselves? And what do we want to make sure we have time for? What do we want to focus the rest of our time on? And I don't know if you can start to see how this weaves into life itself, whether you have cancer or not. I mean, how can we live our best life possible if we don't periodically stop and check in with ourselves and see where we've been and what we might yet want to accomplish? And the last, the nature of spirit. And so that's just however, you see how we might all be connected, where we might be going. All these levels are of great importance. So I hope some of those things might be helpful. And they both have books. Frank has a book that addresses all these things in great detail. And so just to conclude my part, I'm just going to read a little bit here at the end of Dr. Geffen's book. He was with his father, Sid, when he died, and they were both just together sitting quietly and just enjoying the space. And he all of a sudden looked up, and his father was grinning from ear to ear. He looked back at me, and his face was filled with a quiet, peaceful radiance. The room was very still, and I was aware of sunlight streaming in the window. Quietly, I said, "Sid, what's going on?" "Jeremy," he answered, "I'm so happy, so happy." His words startled me because here was my father, relatively young man, 61 years old, lying in a hospital bed dying. His lungs were filled with metastatic gastric cancer, and his belly was filled with gastric cancer and ascites. He was barely able to move without pain, barely able to breathe without oxygen, and yet here he was saying he was so happy. "How can this be?" I asked. "Tell me." "I'm so happy," he replied, "because now I really understand. It's all so clear. We are not our positions. We are not our possessions. All we are is love. All that exists is love. And all that matters is love. And in seeing this, I'm so happy." And in my mind, I would say that that is such a service to one another, whether it's a nurse to a patient, the doctor to the patient, the spouse to the patient, the checkout person at the store to the patient, somebody to help you carry your groceries to your car. It's all about heart connection. That's the best support we can give another person. So I'm going to turn it over to Ronnie.
So, it's wonderful that I was invited here. Thank you, Tom. Number one, I think the biggest reason I'm so happy to be here is I'm passionate about caregivers and the expanded definition that I call my group Together, a support group for family, friends, and caregivers. So what I've done is expanded that definition. And I'm passionate about it because a patient has many sources of care. And sometimes caregivers, family, and friends are overlooked. So I'm passionate about my support group, which makes them the focus. So, oh, that's high. This little chart that I put together shows how many people are involved in the life of a patient. This is the patient. First line of defense, first line of interaction, the caregiver. Second, the family. Third, friends. And of course, the community. Support groups, nurses, doctors, therapists. So cancer is, I'll leave that up. So cancer is a community disease. A cancer diagnosis impacts all relationships. The caregiver, this is the other chart. The caregiver, family and friends, and the patient walk the same path. Here's the patient, caregiver, family, and friends. It goes up, it goes down, it goes around. They walk a similar path, but different. And emotions are different depending on these different roles. The paths mirror one another, but are felt and managed differently. So it's important to understand the stressors impacting each of these different roles. The new normal, that's what we call it, begins with the diagnosis, and that's the first sucker punch. And there's many other sucker punches to follow. We also call it, in my group, the security breach, because there goes complacency, feelings of assuredness, security, confidence. You've walked that line. And when you walked across that line, you don't go back. But it doesn't have to be doom and gloom all the time. It's important just to recognize that position. Treatment decisions have to be made right after diagnosis. It starts with asking the patient, and then the caregiver, and then the family, and then friends might have some opinions. It all has to be sorted out. It's very important to acknowledge, how are decisions made in this family? Every family has a tradition of how they make decisions. They have a pattern. It's important to understand how those decisions are made. So after the diagnosis, there is a shift in roles and duties. Oh, I wanted to mention, you have a packet in here. You can read this at home. It's got almost everything in it and more that I'm talking about, because I only have a half an hour. So it's packed. Joyce and I put this together. It's packed with information. The shifting roles and duties. More responsibility may shift from the patient to others. Usually the first line of defense, the caregiver. There's a caregiver in my group right now who didn't know anything about family finances. Her husband, who is the patient, took care of everything. Now she's had to take over that role on top of everything else she now has to do. So it's important to recognize how these roles and duties shift over and to whom they shift over. It becomes an increased burden when the patient becomes unable to work. And maybe the caregiver becomes unable to work because she's in that role or he's in that role of taking care of the patient. This leads to a lot of stress, a change in work schedule, a change in finances. There was a person a while back in my caregivers group who had just moved to Portland, and her family lived in Santa Fe. Her mother and father lived in Santa Fe, and her mother was the patient. She took a year off from work, lost that income. And somewhat destabilized her home life. She commuted to Santa Fe. When that year was up, her mother was sicker than before. Every 2 weeks she came to Santa Fe, lived in Santa Fe, went back to Portland and worked. Came to Santa Fe, went back to Portland. It was very destabilizing. She survived, but it's important to understand that it was how destabilizing this diagnosis can be. Family dynamics can become worse or changed. When the parent's sick, there's the kid who steps up and does everything, and the kid who does nothing. Does the kid who does nothing step up, or do those roles become even more rigid? Old dynamics probably won't work now. There's a need for a new model. And sometimes that's where professional help can come in, or a support group. The emotions that go along with the cancer diagnosis, I call it a cascade of emotions, because they're all over the place. The intensity and type of emotions shift and vary, hence these crazy lines, during the cancer journey, and they're unique and they're individual. All feelings are valid. In your packet, don't look now, in your packet, there's a wonderful article. It's called The 7 Deadly Emotions of Caregiving. And they are guilt, resentment, anger, worry, loneliness, and defensiveness. And there's many more. But I like this article in particular, and all of these articles are taken from other sources, because it kind of outlines the emotions that occur. Caregivers and family and the close friends of the patient their feelings require validation and acceptance. And that validation and acceptance first comes from self, understanding I have these feelings, and secondly from others. Often, one of the topics that comes up in my group very often is how people are wounded by the comments of others. And maybe some of you have had that experience. We talk about that frequently, and about how to deal with being wounded when you're already in a vulnerable position. Guilt occurs when personal limitations collide with the idealized self. I should be, I ought to be. If you're saying those words, I should be and I ought to be, throw them right out the window, because that's the collision, and that produces guilt. It's a mismatch that needs to be brought into line with reality. It's recognizing your limits and accepting your inadequacies. Because believe it or not, everybody has some inadequacies. The caregiver, family, they're looking for validation, guidance, resources, and spiritual nourishment. There's tons of information in here about self-care. So I'm just going to touch on it, and then you can learn more about it when you go through the book. If a person doesn't engage in taking care of themselves, it can lead to depression, anxiety, fatigue, burnout, illness, and loss of control. Several people over the years in my group have been caregivers, have been hospitalized because they were worn out and put their health needs at the bottom of the list until they collapsed. So one theme, there's two big themes in my group: self-care and build a team. So often, and Joyce mentioned this too, about a patient who comes in, the ones she worries about, who they come in alone. Or the caregiver and the patient, and the caregiver says, we have no one. I'm going to do this by myself. You need a team. What's a team? A team is a group of people who agree to contribute to a patient's care and give the caregiver and family members a break. And we have a saying in my group, you have to choose the right person for the right job. So if it's a person who's driving, you want to make sure they're a good driver. Or cooking, they know about healthy meals, or whatever. Gardening. A friend of mine is going in for neck surgery, and she'll be kind of incapacitated for about 3 to 6 months. And I was talking to her about caregiving, and I said, your husband can't do everything. She said, I hadn't thought about that. She says, because if he does the gardening, I'm not going to have a garden. So, and I said, you've got to start thinking right now, her surgery's in a month, of who is going to be on your team. When a person says to the caregiver or family member, what can I do? How often do people say, oh, nothing, I'm fine? No. If a person says, how can I help? What can I do? Have a ready answer. Oh, you can cook, you can garden, you can drive, you can come visit this person who's sick and can't get out right now. Have a ready answer. The caregiver has to sometimes be counseled to accept help. All too often, we're used to saying, oh no, I can do it myself. And the patient has to recognize that the caregiver needs relief and needs help. Many times a patient will say, oh no, I don't want anybody else in this house. And that's where the caregiver or family member has to become more assertive. Well, I do. Another theme that comes up frequently in my group is some people are going to disappoint you. Some people are not going to step forward. Your best friend that you thought, of course he, she, will be there, may not. And other people that you never anticipated may step forward. So it has many surprises. This journey has many surprises. As I said, the self-care tools are all in this booklet. It's very important to re-own lost parts, the parts of yourself you've given away, the activities you're no longer doing, the friends you're no longer seeing, because you would feel guilty if you went out. It's very important to develop tools for self-care with creativity, because you're building these tools within the new normal. I'm going to do a shameless plug. Support groups are wonderful. And I have an article someplace in this booklet about the value of support groups. One of the people in my group at one time called our group her tribe, because nobody might understand you better than somebody who walks in your shoes. And it's a place that's safe. You can express any feeling there and nobody will judge you. You never will hear, oh, you shouldn't feel that way, or don't worry, it'll get better. No, a support group is your tribe. We have 3, and there's brochures out there, or flyers, 3 support groups at the Cancer Foundation. These are open to everybody who's experiencing cancer, or is a caregiver or a family member, even if a person is a family member or friend and the patient lives across the United States. You're welcome to come. And these are at no cost to you. They're marvelous. So sometimes you need a good friend you can talk to, a support group, or even professional help. So I hope you enjoy this booklet. I hope there's ideas in there that you can use. And believe me, I did this speech like 4 times to make sure I was in the half hour. Whew, I made it. So we're going to open that up to questions. And Amy gave you some cards. And Amy, I left those cards up there.
No problem. If you have
Thank you very much.
Please fill the questions out on the index card.
Thank you.
If you have questions, please put them on the index card.
Or comments.
Or
Yeah,
comments,
comments.
we'd be delighted to hear your comments. Since you're the one on the floor, please talk to us.
I'm also passionate about support groups. In 2012, my husband was diagnosed with esophageal cancer, stage 4. I had a 3- and a 5-year-old children. And what I want to kind of add to what Ronnie was saying about this, I went to her support group. She was the one who gave us our education intro, and then I went to Ronnie's support groups. And then she also started doing individual therapy with my husband and myself to get us through everything. A few other things I would have to say is that support groups, well, they were essential to me to getting through everything. But one of the things I found in them that was so amazing was sometimes it was the only place you could laugh at the damnedest things that no one else would get, or everyone else would think was absolutely macabre and dark, and they would be shocked. But in those support groups, you could all go, yes, I hate it when that happens. Or you could, and the other thing, Ronnie said, first you have to identify your feelings about it, and then you bring it to the place where you're getting support. But honestly, in the support group, quite often, listening to other people helped me identify things that I wasn't quite identified until they spoke it. And I said, oh, yes. That's why I'm feeling this way, or that's why I'm being like this, or that's why. So quite often, that's the other thing, is having that tribe enabled me to sort of understand things that were, or actually what it did quite often was reframe things, so that there would be something that was feeling like I just couldn't figure out what was going on, and then when I would go to the group and someone else would speak about it, it would also very much normalize how I was feeling, especially the 7 sins of this. The
7 deadly sins.
The 7 deadly sins especially very much helped normalize the guilt, the empathy fatigue, just when I was just like, I'm sick of my husband right now because he's, and I couldn't say that anywhere else, because that's horrible to say about this sick person. But sometimes I was just like, oh, this is really hard right now. But that's where I could say that. So,
Thank you.
shameless plug.
Do you want to take this, or shall I?
They're yours. They're very much in your category of counseling.
First question is, what do you do when the patient won't accept help from family, shuts the door on faces of helping, and kicks the helpers out and refuses to talk about it? I have a funny story, and then I'll answer the question. So we had a caregiver in our group who really did need to have and hire some outside help because there really wasn't family around locally to help out. And her husband steadfastly refused to have anybody in the house, kind of this situation. So remember what I said about you have to be creative? So she started to think, what would he enjoy? What would he like? Well, she knew he was kind of a guy who is really attracted to beautiful women. And he was, I think he was in his 80s. Yeah. So she hired caregivers that were young and attractive and qualified women. Problem solved. So that's an example of creativity. The other thing is that sometimes the caregiver needs, or family member needs to be assertive and say, look, I'm burning out. If I burn out, you're on your own. I need help. I need to have people come in, or I need to hire someone. I need to let our kids help, because I'm your first line of defense. Remember that circle. I'm your first line of defense. If I go, you're on your own. So sometimes you have to be a little, you have to be assertive. And sometimes professional help. Sometimes going to somebody like Joyce. She's there, she's the nurse educator, and sometimes talking to somebody like you, Joyce, would be helpful to lay out. Sometimes people take advice from non-family members that they wouldn't accept from others. The other question I have is, how do you counsel caregivers who act like martyrs? That's a hard one. What do you think? What do you do if they come in and a couple comes in and one is...
I'm not the one who counsels them, Ronnie.
It depends what you mean by martyr. Definitely if a person comes to our caregivers group, a person like that would get a lot of very good feedback. And I think that getting feedback from people who are in that boat can be very, very helpful. And that's why I really know that support groups hold wisdom. So that's a very good idea. And sometimes, again, a non-family member intervening can be very productive. Jerry?
Can I just say one thing about martyrdom?
Yeah.
In my experience, in the beginning, a lot of my overdoing it was about the fantasy of control, when everything felt so out of control with cancer. Cancer made me completely out of control, and so I was trying to do everything. And there was, through your help and this support group, I finally realized the things I just had to let go. And just more deal with the fact that everything felt out of control. But in my experience, personally, that's kind of where someone might label that could be going on.
And sometimes guilt can drive martyrdom. And there's some good articles in the booklet about guilt, is that it could come from the disease of overdoing and trying to regain control when everything feels out of control. Any other questions that you didn't want to write down but you just thought of?
And I think we'd also welcome if somebody wants to come up just individually and, has a private question. That's fine as well when we're finished.
So I guess we're finished.
I want to thank you very kindly for coming
welcome.
and speaking with us. I will have to see you soon. Very nice speech.
Thank you.
Drive home safe. Please don't hit any more walls of water. Marlene, go ahead.
Is there a need to do research on caregiving organizations, professional groups?
Oh, I'm so glad you mentioned that. It's in the book. There is Thank you, I forgot that. Right here, in fact, I dog-eared it. Books and magazines and resources. A lot of these are the books that we have in our little library at the foundation, and some tremendous online resources that are very valuable. Thank
All
you.
right, well, thank you very kindly. I do appreciate it, and we hope to be in touch with you soon.
Thank you.